Hi, everybody, and welcome to the Copa Roundup for the week ending February 18th. February 18th, wow, I can't believe we are in our second month of 2022. I think as I get older, time seems to be going quicker. I have a theory about that, but I won't share with too many people. But we are so excited this week to be able to have some people from our Integrated Health Solutions program joining us to talk about some very important services that we provide here at Copa Health. As a matter of fact, I think that the ACT and the MACT, so that's ACT and MACT programs, have such a powerful impact in the community. And I think we're just lucky to have folks here to be able to tell us a little bit more about it. So we're going to start out with Sarah. Sarah, how are you doing today?
I'm doing very well, thank you.
Everything going okay in your life? You staying safe? People around you healthy?
Absolutely, yes, we're being very safe.
That's good. That's good. You know, it's every once in a while I will ask somebody that question, and I can just see by their the look in their face that they're not doing too well. And I think it's very important that we ask people how they're doing. But I'm so glad that you're here today. And then Leonardo. Leonardo, how are you doing?
Hello, Norm. I'm doing well. Thank you for asking.
You know, Leonardo, I forgot to ask Sarah, so I'm going to jump back to her right after we're done talking. But what is your role here at Copa Health?
I'm a case specialist. I technically do everything as a case specialist. I'm a ILS, housing, employment, and
Yeah, Leonardo, you had me at you do everything. I think that that's a perfect answer. And then I'm just so glad that you're here today. You're doing okay?
I'm doing well. Thank you, Norm, for asking.
Wonderful, wonderful. Hey, Sarah, I forgot to ask you. So what role are you in here at Copa Health? And if it's the same as Leonardo, then I'll just look a little red in the face.
No, I'm the independent living skills specialist on the MACT team.
Oh, that's fantastic. Yeah, I'm so proud of the MACT team here. And then we also have Gail with us. Gail, how are you doing today?
I'm doing well, Norm. Thanks.
So Gail, I'm not going to forget, because I know I've spoken with you before, but what is your role here at Copa Health?
I'm the program administrator for the Medical ACT team.
Medical ACT team. So I'll tell you what, can you tell us, Gail, exactly what the ACT team and the Medical ACT team is, what the acronym stands for, and basically the type of work that you guys do?
Yeah, let's start with the ACT team. So Assertive Community Treatment, or ACT, provides a full range of services to people diagnosed with serious mental illness. We offer community-based treatment to people in the most difficult situations. An ACT team has a psychiatrist, 2 nurses, a program assistant, CC, that's me, and 8 specialists, so a total of 13. Mercy Care has 24 ACT teams across the valley. 4 of them are specialty teams. Our very own Copa has the Medical ACT team, and our team focuses on members with complex medical needs. So aside from the usual 13 staff members on ACT, a MACT team has an assigned primary care physician, and the goal is to improve the health and quality of life of the members by addressing both their physical and behavioral health needs. So when you talk about the difference, major difference is with the ACT team, we provide personalized and flexible care. You know, we do that. We provide the services when they're needed. We have the multidisciplinary approach. The staff are the direct providers of the services, and services are always available. To me, I think I mentioned this to Leo earlier, that ACT teams are the Navy SEALs of case management. We handle the most complicated, challenging cases. So it takes a special person to work on an ACT team, medical ACT team. So every person has a different specialty, but we work together as one unit to basically reach the objectives. So I'll end it with, I'd like to think that our motto is like the Navy SEALs. You know, the only easy day was yesterday.
Well, I have to tell you, I think that's a fantastic way to put it. And I am not going to forget that, because that means that you are the best of the best. And I know that at Copa, with the ACT and the MACT teams that we have here, you are the best of the best of the best of all the MACT teams. So, thank you so much for that. That really helps me understand a little bit more about what you do. Leonardo, let me ask you, Can you share with everybody out there, and we're going to have a lot of people who maybe aren't part of Copa Health, or maybe they're not even, maybe they are part of Copa Health, but they're not part of, the clinical teams. Can you tell me what it's like to work at Copa Health, things that you enjoy about it and why you think that this is such a world-class organization?
Well, Copa Health, I've been with MACT for 7 years. Today's my anniversary. And I've started with PIR, which was previously Copa, as a supportive case management. And a few years later, I worked as a transition facilitator for SMI Young Adult team. And later, I was recruited for the Medical ACT team with Copa. And ever since I've been here, yeah, Copa, the leaders are great leaders. They've supported us. They're very innovative with the trends.
Here's one of the things, Leonardo, that I think is so amazing. And you touched on it just a little bit, but the fact that you've done several things since you've been here at Copa Health, back to the Partners in Recovery days, but that you're recruited to be on the MACT team. Obviously, you must be well thought of if you've been recruited to work on the MACT team.
Yes, I was recruited with the Medical ACT team. I've always specialized on specialty teams, and I was attracted to learning more in the medical side, which I've learned a lot being with the Medical ACT team for 7 years. Basically you do a lot of coordination of care with several things, different doctors, endocrinologists, cardiologists, gastroenterologists, urologists, neurologists, you name it. So it's a way to learn, learn, and with the medical, not only medical and also psych.
Yeah, I think that's fantastic. There's a lot of ologists in there, but I have to tell you, I learned by being around the people that I'm around, and I think it's just so wonderful, Leonardo, that you were able to learn and grow, and it really says something about you and about Copa Health that you were able to move from one position to another. I think that's just fantastic. So Sarah, let's jump over to you for a second. Tell me about a multidisciplinary approach to services and why it works so well. I'm always impressed when I hear terms like multidisciplinary or social determinants of health. But tell us why it works so well with the ACT and the MACT programs.
All right. So the MACT team is a group of specialists, and we all have our own specialty. And the way it works is that we communicate with each other, whatever the members' goals are, so we can achieve those goals as a team. So a member may be working on housing, so we work with our housing specialists in order to achieve that goal. And we can work on multiple goals at once because everybody has their own specialty, and the goal, bottom line, is to get the person their needs met.
Yeah, and I don't think you see that in a lot of situations. One of the reasons why I think it's so exciting and impressive that Copa Health has integrated health at the clinics is because I know how many times I've been at one of my doctors and they've asked me about information from another doctor or somebody else that I'm seeing. Whether it was my primary care physician, a pulmonologist, a dermatologist, even a dentist, they don't share information back and forth. And it sounds like the coordination of care is one of the things that you guys, really shine at.
Yes, absolutely.
Well, I'll tell you what, I think I have a better understanding of the ACT teams. I kept saying the longest time, I kept getting the acronym wrong, so I'm not going to say the wrong acronym now because I don't want anybody else to get it wrong. But Sarah, we asked about it a little bit earlier, but you're doing okay. Are you vaccinated?
Yes, I am.
Okay, and Leonardo, how about you? Are you vaccinated?
Yes, I am. Plus the booster.
Plus the booster. I like that. And Gail, how about you? Are you vaccinated?
Yes, I am. Sorry.
No, that is all right. One of the reasons I ask is because I still believe getting vaccinated is one of the most important things we can do, not only for ourselves, but for those around us and the people we care for. I tell people all the time, don't think that getting vaccinated is just a personal thing. You're helping out the world by getting vaccinated. And that also includes the flu vaccination and taking care of yourself in general. But hey, I want to thank all of you for being on with us today. I think that there's so much that can be learned by teams like yours that work together and really have a positive impact on everybody. So Gail, thank you so much for joining us.
Thank you, Norm.
And Leonardo, it was great seeing you. I'm so glad that you were able to join us too.
Thank you, Norm.
And Sarah, I think that we have to make sure that we have you and everybody else back at some point just to tell us specifically about some of the things that are going on with the ACT and MACT teams.
That sounds wonderful. Thank you.
All right, everybody. Hey, that is our Copa Roundup for this week, the week ending Friday, February 18th. Next week, we're going to be, after a short month, on the last Friday of February already. And we're looking forward to seeing you again on February 25th and rolling into March together. I know one of the sayings that, March comes in like a lion and goes out like a lamb, or in like a lamb and out like a lion. But I think in Arizona, it's pretty much just all, something that's hot, maybe a dragon, because it's always just so hot here in Arizona and it's starting to get warmer out there. But until next week, everybody, take care and, make sure that you look out for each other. Just like Leonardo and Gail and Sarah, if you get an opportunity, go out and get vaccinated. If you have gotten vaccinated already, try to encourage others to get vaccinated. It's just so important. And you're not just, like I said, helping yourself, you're helping other people around you and people in the community too. So we will see you all next week. Take care.